Hello. We're doing hot topics in law and ethics. Ethical issues with termination. CAMT, the NASW, and the ACA all have specific ethical standards on termination. CAMT's Code of Ethics states that there needs to be sound judgment used while terminating. They state reasons to terminate include the client not benefiting, lack of clinical justification to continue treatment, or the therapist being unable to continue to treat the client due to being incapacitated or having an ethical dilemma. NASW's Code of Ethics calls out that abandonment should be avoided. It also states that people can be terminated for non-payment if it has been addressed and they are not a current danger to themselves or others. Also, it mentions that termination should not occur in order for a social worker to pursue any type of relationship with a client. The ACA Code of Ethics on termination states that clients should be terminated if the therapist cannot meet their needs. It also states that clients should be terminated if they are no longer benefiting from treatment, for non-payment, and if the client or someone associated with the client endangers the therapist. All three Code of Ethics specifically call out abandonment. They all state that therapists need to try and link clients to other therapists if they are unable to continue treating them. So what is abandonment? Abandonment is a legal issue that's part of medical malpractice cases, and you need 4 aspects in order for it to be considered abandonment. The first is there's an established relationship between the provider and patient. The second is the provider stops treating the patient when they still need treatment. The third is that the ending is abrupt and the patient is unable to find a new provider. And finally, the patient must have adverse effects as a result of the termination or abandonment. What is the standard of care for therapists? Essentially what that means is that therapists do our work in a manner that is consistent in the way that most other professional therapists would do the same thing. Now we're going to move into how to ethically terminate with a client. There should always be a documented termination plan in writing for each client. This should include why termination is occurring, any referrals given to the client, when the notice was given to the client, or when it was initially discussed, depending on the circumstances. So, often it doesn't happen, but what do we want an ideal termination to look like? First, you want the client to have an ability to reflect on what they've achieved in therapy. You want them to see a way forward without therapy. And you want them to have time to process any feelings that they have about ending therapy. So what do you do when you are ending treatment with someone who still needs treatment? 1, emphasize the need for continued treatment. 2, review the reasons you cannot see the client with them. 3, make reasonable efforts to help them find another provider. And 4, making sure that you give them reasonable time in order to connect with somebody else. What are some special circumstances that come up with termination? Scope of confidence, conflict of interest, lack of benefit to the client, closing a practice, ending an internship, financial issues such as non-payment or loss of insurance. Is this a termination or not? And what to do if the client is in crisis when you're wanting to terminate. How do you handle terminating when there's a scope of competence issue or a conflict of interest issue? In both of those scenarios, you're going to handle them as discussed in the referring out somebody who needs services slides. You also want to make sure that you document all discussions you have with the client about the termination and referrals given, And it can never hurt to get some consultation and document that also. What about a termination where there's a lack of benefit of the services to the client? This is obviously a stickier situation. Your best bet is to handle it, is to see if you and the client can get agreement and get the client to accept another referral. Otherwise, you document clearly, and again, you do the same things as in any termination with a client who still needs services. And with the stickier situation, I would also advise getting some consultation and documenting that also. When you're terminating due to the end of your employment or an internship, again, you're going to work through the slide that talked about ending services with clients who still need services. Obviously, in these situations, you probably have more notice and should give the client as much notice as possible as to the termination. In an internship, the client should know from the very beginning of starting services with you how long they're going to be able to work with you. What if you need to terminate due to a lack of payment? So you're under no obligation to work with any client who cannot make their payments. However, as with any client, it's also advised not to make that, especially this type of termination, if the client is in crisis. You really want to make sure that the client is connected with somebody else before you make that termination. Is it a termination or not? This should never be ambiguous. You should always know the answer about whether you're working with a client or not. If you have ambiguity, you might want to develop a policy. I myself have it in my informed consent that if there's no contact for 30 days, that the clients are terminated. Whatever your policy is, it's good to have it documented in your informed consent and make sure that the clients have signed the policy. What if the client's in crisis? As I said in a previous slide, you really want to try to avoid terminating with a client who's in crisis. So you want to get them connected with some sort of crisis management services before you terminate with the client. How much notice should you give a client regarding a termination? This is a depending on the circumstances sort of answer. If it's a difficult or challenging client, you may want to try to give them 30 days, if possible. For an easier termination client, some people may only need a session or two in order to terminate. So again, it's sort of a case-by-case basis, but they really say you want to make sure that the client has ample time to get connected with other services. Do you write a termination letter or not? There's more in-depth information on this in the packet, and many of us had been taught to write a termination letter, but that's not necessarily the consistent recommendation anymore. You want to try to document that you reached out to the client with a phone call or however you communicate with the client, but there does not have to be a written termination letter sent to them. Again, you do what's best for your practice, and whatever you choose, you just make sure it's a consistent decision with any client. Client termination. Of course, clients have the right to stop seeing us anytime, and I'm sure most of us have had clients ghost or call and text a cancellation and say they're not coming back. The best you can do is, if you think they need additional services, is to give them some recommendations for additional services and some referrals where you can. But ultimately, the client is able to make that decision, and you just want to document what you do when you were told about the decision. Some guidelines for a good termination. You want to be thinking about termination from the very first session, and even bringing it up periodically with clients. You want to have any policies about termination available in your informed consent document. If treatment needs to end when the client still needs treatment, you need to document and make referrals. And always make sure you're documenting treatment goals and progress throughout your time working with a client. And finally, as I've said a bunch of times in these videos and along the way, document, document, document. And this is the end of ethical issues for termination, avoiding abandonment. Thanks for listening. I hope you got something from this video.